Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Ms. Chairwoman, for your kind introduction. Good morning and good afternoon from Jakarta, Indonesia. Ladies and gentlemen, first of all, I would like to thank the committee of this event for inviting me as a speaker on this important and strategic webinar. My name is Mohamed Rizal Damanik, and the topic of my presentation today is about the intervention on Indonesian experiences on Islam and family planning or reproductive health. I will begin my presentation with this slide to show you the location of my country. Indonesia is an archipelagic country extending about 5,120 kilometers from east to west and 1,760 kilometers from north to south. Indonesia is located in Southeast Asia, lying between the Indian Ocean and Pacific Ocean. It's located in a strategic location along major sea lanes connecting East Asia, South Asia, and Oceania. Indonesia has total land area of 1.9 square kilometers, including 93,000 square kilometers of inland seas. Based on national census conducted in the year of 2020, the total population in Indonesia is about 270 million people. This is the largest island country in the world. This is about the family planning landmark in Indonesia. I divided the landmark of population and family planning in Indonesia into 3 phases. The first phase was the pioneering period, which was on 1950s to 1966. In this period, the existing law prohibited the spread of family planning ideas. The second phase was the involvement of government in the population and family planning program, which was in 1966 to 1970. With the initiation of New Order in March 1966, population problem became a main focus of government concern. The government embarked upon its family planning commitment in 1967 with 2 main goals: to improve the health of citizens and to address the rapid population growth and engender economic progress. In October 17, 1968, the National Family Planning Institution was thus established as a semi-institution. And the third phase was the implementation of population and family planning program in a centralized system in 1970. And during this year, it was marked by the formation of National Family Planning Coordinating Board, or we call it as BKKBN, as a full government institution. And started in 2004, the implementation of a population and family planning program was in a decentralized systems. So the next slide, we'll talk about the policy and program. Next slide, please. This is about the President vision. Indonesia is currently in the last period of our long-term development plan, 2005 to 2025. We have established our national medium-term development plan, 2020 to 2024. The government of Indonesia has set 7 development agendas, which are in line with the elected president's missions and directions. Among these agendas, 3 of them are highly related to the core business of BKKBN, namely Agenda 3, to improve quality and competitive human resource by providing family planning and reproductive health services. Agenda 4, mental revolution and cultural development by focusing on strengthening family resilience. And Agenda 7, strengthen stability of political security, law, and transformation of public services by particularly being active to promote South-South triangular and collaboration. This is the national policy and strategy direction. To achieve the above targets, BKKBN has set 7 national policy strategy directions. For current webinar, it is greatly correlated with our strategy on increasing family resilience and welfare in a holistic and integrated manner based on an individual's life cycle and strengthening family-based character building. This policy has set its appropriate strategies through strengthening understanding on 8 dimensions of family function, B, optimizing childcare and childbearing of children under 5 years and young children, as well as family-centered character building and formation since the early age. C, improving the care and nurturing of adolescents, improving the quality and character of adolescents and helping adolescents to prepare for family life. D, enhancing families' economic independency, targeting especially long-term family planning participants, acceptors of long-acting contraceptives, especially female and male surgical contraceptives, and family planning participants in Kampung KB sites. E, improving the resilience and self-reliance of vulnerable families. F, strengthening elderly-friendly services by observing 7 dimensions of resilient elderly and improving long-term care for the elderly. Next is building partnership for family development. The other related policy is increasing access and quality of comprehensive family planning and reproductive health services by regions and focusing on target segmentation that are performed by 1, strengthening the capacity of health facilities and health network that provide family planning and reproductive health services. B, improving the quality of partnership for the delivery of family planning and reproductive health services. C, expanding family planning and reproductive health services coverage in regions for specific segments, increasing participation of male contraceptives, strengthening reproductive health promotion and counseling based on life cycle approach, preventing unwanted pregnancies, and increasing postpartum family planning services. And also improving the ability of reproductive age couples to access private family planning services. Increasing the advocacy and mobilization of Bangga Kencana program, taking into account regional and target segmented characteristic by first, increasing Bangga Kencana information, education, and communication outreach tailored by target segment and region. Improving the performance of field worker and empowering community members by mobilizing field volunteers. And then the strengthening integrated family information systems. This can be done by improving the quality and use of Bangga Kencana digital data or information across all levels, and also developing smart technology or smart program to improve Bangga Kencana program administrations. Next slide, please. In the opening of a national coordination meeting of our office on January 28th this year, the President of Indonesia has raised some important points in his remarks, and one of them is about stunting. Stunting is still a problem for Indonesian families. In this regard, the President has mandated BKKBN as the chief executive to accelerate the stunting reduction in Indonesia. The current percentage of stunting in Indonesia is 27.7% and has to decrease to 14% by the end of 2024. Next slide. When we look back, Indonesia actually could learn from its success story in reducing stunting cases. From 2007 to 2013, Indonesia has reduced the stunting rate by 0.4%. Meanwhile, from 2013 to 2018, the decline has increased by 9.5% within only 5 years. Of course, this experience is interesting. BKKBN realizes that stunting has increased due to the pandemic. However, BKKBN also wants to learn how to accelerate the stunting reduction from other countries, as well as learn from Indonesia's successful experience. In the 2015 to 2019 National Medium-Term Development Plan period, the decline in stunting was at an average of 0.3%, whereas in the 2020 and 2024, the National Medium-Term Development Plan, the reduction target is 2.5%, which means zero additional stunting. To achieve these targets, an accelerated reduction in stunting is required. Next slide, please. So, what is the strategy? The strategy is convergence trials to strengthen the field lines which are being carried out to accelerate stunting elevation in South Sumba District, North Nusa Tenggara Province through pre-marriage, pregnancy, and periodic approaches. Next slide, please. Now, I will talk about the partnership with the Ulama and faith-based organization. Slide, please. So, Islam is the majority in Indonesia, which also has the largest Muslim population in the world, with approximately 202 million or 88.2% of total population of Indonesia. The majority Muslim adhere to the Sunni tradition, mainly of the Shafi'i mazhab. There is an evidence of Arab Muslim traders entering Indonesia in the 8th century. However, it was not until the end of the 13th century the spread of Islam began. The Indonesia's early people were enemies, Hindus and Buddhists. Next slide, please. So, these two organizations, the largest, the biggest organization exists in Indonesia. They are Muhammadiyah and also Nahdlatul Ulama. As you can see clearly in this slide, Muhammadiyah was founded in 1912 and the Nahdlatul Ulama founded in 1926. These two organizations has branches throughout Indonesia. For Muhammadiyah, approximately about 30 million followers, and then runs mosque, prayer houses, clinics, hospital, poor houses, school, public libraries, and universities. On the other hand, Nahdlatul Ulama focuses on many of the same activities as Muhammadiyah, operates a majority of the country's Islamic boarding schools, claiming approximately 40 million followers, and this is the largest organization in Indonesia, perhaps the world's largest Islamic group. These organizations, Muhammadiyah and Nahdlatul Ulama, have long advocated religious moderation and a communal harmony. Next slide, please. Another biggest organization is about the Indonesian Boarding School Cooperation Agency, BKSP. This organization founded in 1972 by scholars leaders of the Muslim movement, and elders of Islamic boarding schools. This agency has good coordination and communication with thousands of boarding schools, or in Indonesia, we call it as pondok pesantren, throughout Indonesia. It is kind of tradition, if cannot be said as a prerequisite in Indonesia, that an ulama must have and lead a boarding school. Next slide, please. Now about the role of Majlis Ulama of Indonesia. The Majlis Ulama Indonesia, the Council of Indonesian Ulama, was established in 1975, has issued various fatwas concerning the issues of worship, marriage and family, food and drink, culture, social affairs, interfaith relations, and medicine, and many other issues. Majlis Ulama is guided determining a fatwa after true research into the basic or arguments of the Al-Quran, Hadith, and Ijma and Qiyas as practiced by Sunni schools in general. In issuing a fatwa, the Majlis Ulama considers the situation and condition of the community, so it brings benefit to people and in line with the Islamic law. Next slide, please. There are two major roles of ulama of Indonesia as the carriers of the Lord's teachings and its role as a community leaders. First, the role of carriers of God's teachings to teach, to guide, and give example in practicing the teachings of Islam in daily life. The Islamic scholars give speech and explain about various Islamic subjects and other subjects related to general daily life, and become an example of role model in running the whole Islamic teachings, the daily life, for example, family life, societal, nation, and state. Next slide, please. The second role of ulama is that ulama are part of community leaders in general and the Islamic society. Ulama is a Muslim community leaders who became a coach, mentor, and liaison between the Muslims and the government. Ulama and Islamic religious leaders must be able to involve and participate in the country's development program, and the aim is to improve the quality of life and the lives of Muslims in particular and the inhabitants of Indonesia in general. Ulama and Islamic religious leaders integrates development message issues into the substance of the related Islamic lessons in the Islamic schools and pesantren, Majlis Taklim, and other Islamic sermons. Ulama and Islamic religious leaders work with BKKBN to give motivation and information, education, and communication regarding our programs. Ulama writes the book or publication about reproductive health and family planning. And in accordance with this role, BKKBN involve ulama and Islamic religious leaders in seminars, workshops, study visit, and talk show in radio and television. Ulama has major roles in producing and launch fatwa related to family planning and reproductive health. Slide, please. This is the process for issuing a fatwa. This slide briefly shows the process how the fatwa are issued by the Majlis Ulama. For example, there is a phenomenon or issues that occur in the community. Then this phenomenon can be proposed to the Ulama Council and ask the fatwa. For example, is the usage of the method of vasectomy or tubectomy in reproductive technology, whether it is allowed or not. This issue is then brought into the Fatwa Commission meeting contained in the organizational structure of the Ulama Council. If the Fatwa Commission can decide on this case, a fatwa will be issued on the case. But if the case cannot be decided immediately, and requires further information or wants to hear the opinion of other parties, then the Fatwa Commission can make various efforts, such as discussion with experts in those fields. And the result of the discussion are then brought to a Fatwa Commission meeting to be tried and decided as a fatwa. So the following slides we show us the collaboration program of activities between BKKBN with the faith-based organization in the area of family planning and reproductive health. For instance, this one, My Choice program, is collaboration with the Muhammadiyah and Muslimat Nadatul Ulama in several provinces in Indonesia. And this is about the support of the provision of family planning services through faith-based organization clinics. And then this is about the advocacy and information education program. And then this is adolescent reproductive health program at Islamic boarding school and faith-based youth organization, counseling, reproductive education, using educational games and other activities, increasing the capacity of partners, especially regarding the substance of family planning, reproductive health, and other issues. This is about the challenges. We still have challenges in family planning, like CVR is still stagnant, very high dropout rate, unmet need is considered still high, right? And median age merit still low. And this is another Kampung Kabo. So conclusion, next slide. So this is the conclusion of my presentation. I think there are 5 points here that I present. And next, thank you very much for your kind and attention. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Thank you.